Okay, brilliant. So hi everyone, welcome back. We're gonna open up the Q&A session for today's PsychedelX participant presenter. Thank you guys for being here synchronously. We appreciate you taking the time and congrats on some great presentations. So today we have present with us Joelle, Liam, Eric, and Naomi. Unfortunately, DeAndre, Cameron, and Eugenio could not make it. So if you have any questions for them, please type it out using the Q&A button, include your email address, and we'll send it to them so that they can follow up with you on their own time. And yeah, so we're just gonna get started. We had a couple questions in the chat for Liam, so we can start there. So Liam, I have one here. It reads, I'm not sure exactly what part of your talk they were responding to, but they say, I agree, but the general public will all care about different things. For example, the industry has intentionally gone with the narrative of healing veterans because it's a cause that most Americans care about. What other audiences do you think need more quote unquote humble wording about psychedelic therapy in your opinion? And do you agree that audience matters or the strategy you present can be applied to all?
That's a great question, and thank you to whoever submitted it. The first place my mind goes to here is that yes, audience matters so much, and the identity of that audience matters a lot. I think the veterans community is a really good example, in the sense that it's made this topic a much more bipartisan one. People tend to think of this as a people may think of this as a progressive movement in a lot of ways. And I think involvement from a community like the veterans community has done a great job of showing that these compounds really have something for everyone, regardless of the perspective you're coming from. Um, I'm not sure a clear answer is coming to me off the top of my head in terms of like a parallel example of that. Um, but I think that's my first reaction to that question, is really just agreeing with it more than anything. I'm sorry, yeah, I hope that's a satisfying answer.
I think that that was really well answered. I think a lot of things, it's hard to put you on the spot. And also, we are dealing with complex questions here, right? There's a lot of nuance. And I think that's what's exciting about having these discussions. So thank you for that. We had one more question for Liam. It says, I love these strategies, but arguably the ineffable is what drew a lot of people to psychedelics. For example, the doors of perception. How do you propose to keep psychedelics exciting enough for mainstream news, but still simple enough to be taken seriously? And what communication channels do you use for both?
Mm, okay. Well, I'll start by saying that the ineffability of these experiences is still there, regardless of the strategies we use to communicate them. So, on a personal level, you know, these experiences are still going to be just as in like they are going to hold the same amount of depth, regardless of how humble you are when it comes to translating those experiences to other people. So the thesis of my talk is not to take away from that at all. If anything, it's in celebration of that. But the point I'm trying to drive home with my talk is that, particularly when we're talking to people who haven't had those experiences, it is extremely important to dial back our language because, quite frankly, because of how hard to understand it can be without a shared point of reference. So I really appreciate that question, because maybe that's something I didn't highlight in my talk. Uh, my suggestion that we dial back our language is purely a communication way we should be interpreting our own psychedelic experiences. Um, I like that question.
Yeah, Liam, thank you so much for your answer. I think it really plays into, like we said, a lot of the nuance here, right? Of I like especially that this conference is so interdisciplinary, and so what it means to communicate where we're coming from to different audiences and keeping that in mind. That was really great.
Totally.
Um,
Thank you.
and yeah, of course, thank you for your time. We have one more individual question before we go to some that can be for all of you to answer. And that one was addressed to Naomi. Um, so someone asked, do you accept that this given narrative is not person-centered? For example, the war on drugs, legalization of drugs, regulation of drugs, licensed drugs. My point is to always refer to a human in these expressions as it is not about an it, but about ourselves.
Yeah, definitely. I mean, I love, that narrative that we're speaking to, centering it on the person that it is people that are being criminalized, and especially with the war on drugs, it is people that are being harmed by the prohibition policies. It's also select groups and communities of people that are being targeted by the war on drugs. And so I think in my presentation, when I was talking about these different policies such as legalization, decriminalization, just kind of using it more broadly. Um, but yeah, sorry, I'm just trying to think about how else to really go in depth because I think with my talk, what I was really trying to get at was the different issues within this within kind of the field of psychedelics within like and how to be looking towards the future of bringing this more mainstream and part of that is the issues around legalization, the issues of that these drugs are still scheduled, they are still criminalized, people are still being criminalized for their use. Even if things can become medicalized, there will still be some criminalization with medicalization. And I think that's kind of the different points I was trying to get at, is, the place we're currently at and where we could be going forward. But yeah, I think I really like the idea of using the human-centered language. I think I'm going to try to incorporate that more into my work going forward. I hope that answer was helpful.
Yeah, sure thing. Great. Oh, and I see, okay, Kiki and I are going to switch off now. So Kiki will ask everyone some of the more general questions, but I appreciate your responses to the individual ones that were asked. So I'll pass it off to Kiki now.
Actually, I see here one more for Leandre. One individual one. Oh, Leandre's not here. Sorry. Sorry, I'll go on with the with general ones. So that's a general question for all of you. So we have the first one. What do you hope the future of the psychedelic space looks like? Anybody wants to?
I can start off. I think it's kind of because also that's where my talk was really focused, is, looking towards the future. And what I see is one that is, just and equitable, where people have access to it, through legal means, and also that they don't have to fear risk of criminalization. They don't have to fear risk of stigma. There's also a lot of, I really hope there to be a lot more education, especially specifically public education. It's a lot of where my interest lies, in that as we keep moving forward in getting these substances more, either through medical access or through recreational personal use access, that the public is really educated on responsible use and harm reduction with psychedelics, whether that be public education in schools, which, still there is the legacy of DARE. Young people are not being educated on responsible and safe use of psychedelics, even though we know they are using psychedelics. Also, public education for families, public education for just anyone who's psychedelically naive. And with that, I think proper like education, and what I mean by that is I think evidence-based like information, because some people are getting their information from possibly not credible sources, and so making sure that education is paired with that.
Yeah, I mean,
Thank you,
kind of.
Jeffrey. Oh yeah, yeah,
I want to
of course.
piggyback off of what Naomi said, because I think also a lot of times right now, when people are using psychedelics, it's a means of them taking their health into their own hands, and like although that's a good thing, and like psychedelics empower people to do that, it's not everyone has that access, and it's unfortunate that people do have to take their health into their own hands instead of being able to work with a treatment team to actually use these as tools for their health.
Great points from both of you. Thank you so much. The next question for it's addressed to all of you. Are there any unexpected risks associated with your topic? What are some of the big unknowns?
I'm sorry, could you clarify? You said what are some of the biggest risks about our topics?
Unexpected
Unexpected
risks associated with your topic.
risks. I don't know. I don't know really how to interpret that exactly. My topic was really about media's portrayal of psychedelic therapy and also um just public perception. So I don't know if there's like really a risk, but I think I did address in my talk, people that are reading about psychedelics and either seeing things that are super misinformed or just really basic surface level, where they're seeing like, an article from the New York Times being like, this is an amazing new therapy we should all check out. And just, as most of us younger people do, maybe even just seeing the headline on Instagram and like just assuming that psychedelics are super safe now and like we can use them. I think there's both of that going on. So my big thing in talking about the media is that like we need to find the nuance and like think of new ways to communicate in depth about the risks of psychedelics themselves, using them, like Naomi was saying, credible sources, getting credible sources out to people. A lot of naturalistic psychedelic users go to Reddit and places like that to get their information because it's not legal and there's not a ton out there. So just getting out there and getting ahead of it and starting with public education. Yeah. Also, I just want to say, shout out to Liam. I was the one that asked both of those questions. So thank you for answering them. Sorry to put you on the spot with them. I would love to connect further with you and also anyone else like interested in the communication of psychedelics because I have a media background. So thank you for answering those.
We we should chat because I work at a PR firm in the psychedelic sector. So
It's very cool to see this connection happening and
I'll
again that
chime
we're all
into
really,
this question as well
oh, go
quickly.
ahead, Liam, go for it.
Sorry, my connection's a little lagged. Um, so risks associated. I thought this was an interesting question. As a refresher, my talk was basically about bridging the communication gap between people who have had experiences on psychedelics and people who haven't. And one thing I may not have recognized explicitly in my talk, but was definitely on my mind, is um, essentially the risk around, um, honestly, negative consequences that can come out from having these honest conversations, perhaps in the wrong context. And so, what I'm thinking about when I say that is it's obviously true that stigma and cultural baggage still exists for these compounds. And that's actually at the heart of my talk. And my talk is about moving past that stigma. But what does need to be recognized in certain circumstances is that for some people, the stigma is so extreme that even beginning a dialogue around this topic can hold risk for certain people when it comes to basically, for lack of a better term, coming out about their interest in psychedelics to potentially the wrong person. Um, and that can include really heavy um, personal consequences, or even like in the wrong circumstances, legal consequences. So the only risk that I would want to acknowledge with my talk is, while I'm basically encouraging people to have more vulnerable and open dialogues around this topic, um, I don't I do want to recognize that that might not be the right decision for certain people. If if, for example, if they're trying to open this topic up to their family members, um, if the level of stigma coming from their family is so extreme that it's just not a conversation they're ready for, that is totally okay from my perspective on this topic. And that I'm glad this question came up because that's an important thing to address.
Absolutely. Yeah. Thank you so much, both of you, for that. I think it adds a lot of nuance, as we've been saying, to what we're talking about. And Joel, I actually had a follow-up question for you. There was an individual one that was asked that I think relates a lot to what you were talking about, which was that we saw a small part of your documentary, which was really fascinating, and I'm personally looking forward to watching the rest of it. But what are some ways that young people can help shape psychedelic media in a responsible way? Kind of what you were talking about of not having these binary extremes of either this is like the most awesome thing ever and everyone should use it, or this is really dangerous, kind of on Naomi's end of it, of like this is dangerous and the biggest evil and we need to criminalize it. I think, as you've said, media likes to sensationalize one or the other. So as young people who are part of trying to forge a way forward of the nuanced middle ground, what are some ways that we can shape and share media in a responsible way?
Thank you for asking. I think this is a problem that affects everything, like not just learning about psychedelics, but learning about anything in the media. Like our media landscape has changed so much in the last even just decade. Like I said, it's competing for over in an oversaturated online market, right? The complete like model of journalism has changed entirely. Local news is shuttering every single year, and we're just seeing like media conglomerates like controlling narratives. And so the biggest antidote, I think, to that is just having media literacy, like knowing like when you see something, making sure you're doing lateral reading, which means like if you see a claim, make sure it's substantiated and that it's repeated elsewhere. Making sure that what you read isn't just so biased on one side. That goes for conservative and liberal media. A lot of things are politicized now, so it's hard. It's really hard, but I think what I do is like look to smaller independent news, public media, local news. In psychedelics, there's so much good publications that I've just learned about. I got to actually write for one during psychedelic science, which was so cool. So just like making sure that you're looking actively, you have to actively look for it, I would say. And yeah.
That's great, Joel. And I guess this kind of opens to everyone as well. What are, I guess this is more, okay, this is not a new question. This is what we were saying before of like the risk of it being miscommunicated, of what would happen if you're not taking a nuanced perspective. But I guess you already went in that direction. Kiki, I'm brain farting. Do you have anything that you want to ask? Or even honestly, you guys, if you have things you want to ask each other, it's pretty open. I mean, this is completely separate. I unfortunately also had a prior commitment and couldn't make most of your talks. I only got to see Eric. So I'm kind of going off of what you've told me about them. But I just personally, one of my concerns about this binary, this is the best thing ever or the worst thing ever, sort of sensationalization. I work in clinical trials research with Bianca, and I think a lot of the time people take the he did one or two dosing sessions and this person is like cured of their PTSD or their depression and they take that and run with it. And what kind of scares me is that a lot of the funding for these clinical trials are from pharma companies. I wonder whether there are people who want to be like, pick up MDMA at CVS and do this in your house or deal. And I think that sometimes the distillation of it down to it being just about the medicine and not about the context in which it's used can be dangerous also, right? Because we have so much time that we do prep therapy sessions and you have facilitators there with you for it, and then you do like many months of integration therapy afterwards, right? So it's not the compound alone that is having these profound effects; it's the combination of the two. And so I think the tricky thing is, on one hand, I'm wary of marketing this as something that anyone can pick up in any context and use. Again, also separate from not just the clinical context, but the indigenous context and the spiritual and cultural infrastructure around using these medicines. But on the other hand, do we want to be so exclusionary to not recognize that there is recreational use and people that are, accessing this in their own time, in their own way? I had seen some other talks too talking about like a kind of anthropological study of this at festivals in Germany, sort of thing. And so what does it mean? Kind of like Joelle was saying, to have their style harm reduction of like, if you are going to be doing this yourself, what are ways that we can mitigate harm and make sure that you have the supportive context to make it a positive experience? So I don't know if anyone wants to speak to that, of like infrastructure that makes this more or less helpful, or adding some nuance into like when it's good and when it's bad, but that's just what's coming straight off the dome. I don't know.
I can actually start off with this because I'm very passionate about harm reduction. I do a lot of harm reduction. For context, I live in Philadelphia, so I do a lot of harm reduction work in Kensington. And I've done a lot of harm reduction work at SSDP. And so I think harm reduction with psychedelics is lacking a bit. I think there is that knowledge, but it's all very like people who are in those like or in those communities who like are on like Reddit or look or are going to festivals, like they are kind of learning from each other harm reduction, but there's not harm reduction education. And I think that's a really important like framework we need to be putting into drug education is harm reduction, and just how to stay safe, how to test your drugs, there's all these things. And also kind of going off what you're kind of speaking to about those concerns of like medicalization of MDMA, like if anyone can pick up in their pharmacy. Um, I have kind of maybe it's like a controversial opinion, but like I think that that's kind of completely fine, like in a kind of prescription sense. I think, and like if someone chooses to use drugs, that is their choice, and they should be allowed to use whatever substance they want to in a safe context, and we can provide that in a safe way. I think that we can be having either it's a pharmacy or it's a dispensary or some type of store where someone is going and they know that those are safe substances, that they are not having to worry about testing, that they're not having to worry that, they also know the dosage, because that's also a part of harm reduction, is not just worrying if something could be with adulterants. It's also that not everyone, you don't always know what dosage you're getting, and that can create some risks for people. And so I think a lot of this comes with just proper, harm reduction, either putting it into structures that are already existing, putting it into I've spoken to this about with a few of my interviewees about speaking to the Department of Education and almost creating like harm reduction drug education that's supposed to be in our public schools. Like what is that going to look like, and how psychedelics can be included in that, or creating a psychedelic department within our government. And I and I'm sure a few other people have a little bit of some wariness of the government involvement with psychedelics, which I definitely have some feelings about. But I think as long as we have kind of those structures, those kind of like regulatory structures, we can allow for some like flexibility while also making sure people are going to be safe. And especially if we include any kind of legalization or decriminalization within that, that people are also safe from being criminalized for their use.
Yeah, thank you for that, Naomi. I actually don't think that that's a controversial opinion at all. I would tend to agree with you. I don't know, but I think, yeah, my wariness was more so around if this is prescribed without context or harm reduction information, right? Of like, if people are told that this will help you unilaterally, no matter what, it'll cure your depression if you take it sort of deal. And there's no conversation around like, do you know what I mean? Like if it's being used prescriptively as something that you are told will cure an illness, then that's where I become concerned. But like I completely agree that it would be much better to bring that out from underground and have harm reduction context spoken to with that. And also, like you said, for recreational usage as well. I'm in no position to tell people how they want to use it. It doesn't have to be only as a medicine. And so, bringing it out from underground and having access to that type of, like you said, dosing information and knowing that it's not adulterated, I could see that being super helpful. Um, yeah, thanks for that, Tammy. Anybody else have anything they're thinking about right now they want to chat about?
I just want to also say, Naomi, we should connect because I'm in Philadelphia and I would love to get more involved with harm reduction in especially that area. I mean, my area in North Philly where I went to Temple, so and like very close to Kensington, all that. So would love to talk to you about that, and get involved. And I just want to speak to this other part of your question, Zoe. I think you had about like the medicalization and I guess sort of capitalization of psychedelics. So yesterday, Ife Tao Harvey, who I interviewed, she kind of like really talked about the capitalization of psychedelics and like sort of the hypocrisies of some of these conferences where we invite people and we invite all types of people, but like it's still really mostly one type of person that is the face of the psychedelic renaissance, and it's the biggest advancements in the movement have come from big companies like Compass Pathways, and I would say, like, no matter what your views and opinions are about that, like, to me, the most important thing is that we're having the conversations and that we're not stifling the conversations. I know one of the journalists she mentioned, Shayla Love, has been banned from a psychedelic conference or was banned from a psychedelic conference in Miami a couple years ago. I think when I first like came into the scene and like was studying and reading things and listening to podcasts, I noticed there's like a lot of weird infighting about this topic, about people who have, different thoughts and opinions, whether they're, like socialist or whether they're like capitalist. And it's just like we have to still invite the conversations. Like ethics should be at the core of everything. And like if you're in this space, like making sure that you're never judging someone from their point of view and just really being open to everything, and raising awareness about the concerns of capitalization and medicalization of these drugs. And yeah, also bringing harm reduction into, I think that Gina mentioned too, Gina Giorgio today mentioned that that could be examined more. So just having the conversations, that's where I want to come in. That's where Liam's going to come in. So all of us just glad to talk about it.
Yeah, thank you, Joelle. And I think we had a question from Kikio.
Sorry. Oh, I think we were was talking to Bianca one day, and we were talking about, you know, a little bit of a negative shift in the field, especially in the US. You have a very polarized political situation there. Let's say I'm from Europe, so I see it from afar, and I'm wondering if you've seen because we hear about it, and I want to see if you've seen it, if you have experienced a shift, like a maybe negative or maybe positive shift in the field after the new administration came in power in the US. I don't know if it's too politically charged, but I was just wondering.
Um, I can answer this. I think there's people writing about this right now. Um, I know an article just came out. I think Jules Evans wrote it. He's someone who's like in charge of the challenging psychedelics. Liam talked about him in his talk. I think he just came out with an article about RFK and, that part of our administration he's running and their views on psychedelics. I think a lot of people are trying to make psychedelics nonpartisan and remove them from politics, but I also think psychedelics are so intertwined with culture. Like if you just think about the counterculture movement in America, like to me, that's like when psychedelics really came into the scene and like blew up mainstream. And that was a huge part of that was like cultural influence. So I think it's too hard to say like, oh, we can just make these substances super scientific and like they don't have to be political. Like I kind of think they're always going to be a little political and our relationships to drugs is political, right? Like why are certain drugs stigmatized and others aren't? It's just you can't remove it. And I think this new administration, like, yeah, there's maybe some good things, but I think there's also some bad things too. And just keeping aware, keeping tabs on it. I don't want to, get too political, but I think you can't completely divorce psychedelics from politics. I think it would be kind of silly to even try. I think you can be bipartisan, but understanding that political views are always going to affect your drug views, really, especially in this country. I don't really know too much from the international point of view, but yeah.
Thank you so much. Thank you so much.
Y-
Um,
Yeah, I'm curious from your perspective. You said you're coming from Europe. Where in Europe are you?
I'm from Greece.
So am I. That's funny. My mom's Greek. Okay, we'll talk about that later.
No way.
Um, yeah, okay. I'm not gonna bore everyone with it. Okay, but yeah, so how does that for you? Like, what is the cultural conversation where you are on this?
So I don't know. I've been in this weird situation because I was living in the Netherlands in the latest years, which is a little bit, it's completely different than Greece. And now I'm back and I'm also doing harm reduction. And it only now came, in the spotlight. Like maybe you have some retreats in the Netherlands, like you don't have it's like an emerging field. For example, like psychedelic assisted therapy or harm reduction for psychedelics, safer use. It's it's new, fairly new, even in the Netherlands, let's say, especially with psychedelic assisted therapy. Um, it's like we make one step forward and two steps backwards because we also have a little bit of a far right, the far right and all the cultural shift that comes with it emerging. Um, so when it comes to research, uh this is a little bit more it's a little bit more positive for us. We don't have or like all the efforts for defunding research, it's like not happening. For example, in the Netherlands, the government or like the supposed government that actually did not come to power, they wanted to cut funding, including the lab that I used to work in Maastricht, which we do psychedelic studies. We were doing psychedelic studies. Um, it didn't pass. So I think it's a little bit different. It's kind of new. So I think we have a different perspective. Like, we don't have ketamine clinics, which is great. It's great. So yeah, it's like a mixed situation here. You do have like the cultural shift, some being very against, some being, very proud to it. But yeah, and I'm also like, I don't know if I'm the best person to talk about this because I'm, between two countries that are completely different when it comes to policy and views. But yeah, as far as I've seen from these two countries, this is the view that I have.
I would say if anything, you have a unique perspective because you've seen both. So thanks for sharing that, Kiki. I also wanted to
Yeah.
bring Eric in because I know we haven't gotten to hear much from Eric. I know that your talk was discussing a lot about substance use and substance use disorders and psychedelics and how they can be used to treat them. And so I was curious about your perspective, especially in our discussions around harm reduction, maybe harm reduction in research, or kind of the politicization of different types of drugs and how they might interact with each other. I'd just be curious if you have any thoughts.
In terms of harm reduction, I definitely think like I don't know, something that came to mind for me that I don't know enough about, but I'm curious about is I saw that there's now like at home ketamine therapy that people are doing like through companies like Mindbloom, I think, where they can order I think pills of ketamine to their home. And I think they meet with therapists online, but I would be concerned at like certain ways that accessibility is increased because like although I guess that does make it a lot more affordable for a lot of people, there is an abuse potential with things like ketamine. So I think we need to do a much better job at like honing in how we make these accessible, like even in medical contexts, like whether like at home therapies like would be beneficial and allow people to get more out of it or connect like personally more to their experiences versus in a clinic and working like with a doctor, like even if that has higher associated medical costs. So I think that even in the context of like medical and like legal psychedelic assisted therapy, we should do research into harm reduction and how abuse potentials might interact with things like that. Because yeah, I've been volunteering with a company called Unlimited Sciences where like people will call in and pretty much ask questions about psychedelic substances and we're able to give them evidence-based responses like based on scientific literature and like through that I'm seeing how more and more people are looking for medical solutions from these and don't like they have a lot of questions themselves, the people that are like looking for health benefits out of these and they don't even fully understand like the the context um of harm reduction and those things. Like I had people asking me about mind bloom, for example, and how that'll affect them. And like I think there's a gap there because we don't know enough about that yet.
Okay, thank you so much for sharing, Eric. I think that's really interesting, and ties in well with what we were talking about. Yeah, I guess we're coming up on time before our next section of the conference. So I just wanted to throw an open net for anybody if there's anything else that you want to share about your talk, anything in closing, if contact info in the chat, if there's anyone that wants to reach out to you, any final thoughts before we wrap it up. And I appreciate your insights so far. This has been really interesting.
I was just gonna say, if anyone wants, I could drop the issue brief that I mentioned in my presentation. I've never formally published it. It's just like written as a PDF, so I could drop that in the chat if anyone wants to read that along with my email if anyone wants to talk about it.
Please do. I mean, that's the whole thing here. We don't have to be formal. It's a student conference just to show what we're working on. So please do drop that. And shout out Joelle as well. I thought you plugged your documentary in the chat, so everyone should definitely watch it. I
Yeah.
loved the sneak peek we
I'm
got.
watching. I know I'm watching it. I was about to say that. I'm sorry for cutting you.
So,
I think we're should we Zoe, do you have anything else that would you like to add to
no, I
say?
just wanted to thank everyone
Thank
for their insights and discussions, and I look forward to connecting more later and rewatching the talks that I missed and then talking to you all about them. So, thank you for your time and your insight. And I think Bianca is going to transition us over now to our talk from the Zendo project. But thank you guys.
Thank you.
Thank you.